For medical imaging, CAT scans, and MRI, I'm going to cut this into two parts, so part A and part B. So there won't be a quiz on this today. You will have a quick reading about the CAT scanner up at the North Bay Hospital, and there'll be a quick little Dropbox assignment on it. What I want you to do this weekend, though, is to spend some time on your ISU, try to get that finished. And if you've missed anything from before, you have done some quizzes, get those done as well. I was on the phone for an hour today with the Desire to Learn people, the D2L or Bright Space, whatever they call themselves now. The woman had me doing all sorts of crazy, nutty things with that quiz, but it's still not working. So I'll just keep updating EDSB periodically through the day so you can see what your attempt marks are. And again, just keep trying. I don't care if you read your notes 1,000 times in between attempts. You just go for it, because I'd rather you learn stuff from all this than not. Okay, so let's just get started on this. So what are we going to use a CAT scan for? So again, remember, CAT scans, they're going to be way more expensive than just doing an X-ray or an ultrasound. So your doctor is not going to immediately tell you, okay, go get a CAT scan. Sometimes they do, depending on the injury. You can kind of tell that you need a CAT scan, but they're going to start with the cheaper technology first and then move their way up. Because if you can see a broken arm on an X-ray, there's no need to go in and do a CAT scan if it's a simple broken arm. A little bit more complex, or a broken back, or vertebrae in your back or something like that, then of course. Okay, so they're going to look at using a CAT scan to look into an abnormal X-ray. They can get a nice picture of bones, your muscles, your fat, your organs, and your blood vessels, and they're going to use it for neck and spine injuries as well. Okay, so bones, muscles, fat, organs, blood vessels, and for your neck and spine. Alrighty, so where does this name come from and who invented it? Well, there used to originally, the name came from computer axial tomography imaging. So this basically means that a computer takes slices, so the tomo means to slice, is going to take picture of slices of your body, and you're going to be sliced in the axial direction. All right, so that's when CAT was for computer axial tomography. But now, they do slices in all sorts of different directions. They can do them sagittal or frontal as well. So there's no point in calling it axial tomography imaging. Alrighty, so what you're basically doing here is we're going to be using X-rays again. So we used X-rays to do X-rays. We're going to use that electromagnetic energy to get a 3D image. So this time we're going to be able to get an image. The pictures still come out as 2D, but we can take a whole series of pictures so that we can get the depth of the injury or whatever it is that we're looking at, or the organ. We can get down deep. We can dig deeper into the organ. Okay, we're on an X-ray, we just get the surface of it. Here with a CAT scan, we can dig deeper into that tissue. All right, and it was developed by Godfrey Hounsfield and Alan Tormack in 1972. So this is a fairly new technology. Now, how they measure some of the shades of gray on the CAT scans is by Hounsfield units, which you don't ever need to know that. It's just kind of interesting. If you ever see where they say Hounsfield units, you'll know they named it after him. Okay, so basically how this thing works. So the same thing, you guys know with an X-ray, we're going to shoot high energy particles at a person. Some types of tissue are going to absorb the X-rays. Other types of tissue are going to allow the X-rays to just pass through and hit a detector. Where it hits the detector is going to be darker. So it's exactly the same technology. We're still using those X-rays. The only difference is this time we're going to, I got a picture that's coming up in a little minute, but we're going to have the X-ray machine on one side of the person, the detector on the other side, just like normal, but we're going to have it circle around the person like in a big donut kind of a thing. So it's going to circle around the person so that the X-ray beams can shoot through the person in all sorts of different directions and then be picked up by the detector. Now that sounded a little bit more exciting than what it actually is. All right, so in this particular case, the X-ray beams are going to move around a patient and not just randomly shoot around a patient like I just made it sound. It's going to go in a controlled, pattern set for by the computer. Okay, but at the same time the beams are moving around, the detectors are also moving around opposite of the patient. So it's going around the patient oppositely. Okay, so what the machine is doing is it records slices of the body. So we're going to be able to slice the body in different layers. And then again, we're going to take all that information and the computer is going to do all the work here to form a detailed image. All right, so if you've ever had a CAT scan before, pretty straightforward. Again, you can watch a video on it. You're laying on a table most of the time. Usually, in most cases, you're going to go in feet first. It's kind of chilly in that room because, again, this machinery has to stay at a certain temperature. This technician, when she's finished, will run to the back room so she doesn't get beamed by x-rays. It'll just, the machine we have at our hospital here, this part moves back and forth over the patient, all right? So it's the part that moves. The patient just lays there, and then this just moves back and forth, all right? The new machine they have actually talks to you and tells you what you're supposed to do, like inhale, hold your breath, exhale kind of thing, which always makes me a little bit nervous, if not nervous, but I always think, like, if you're a patient with dementia or an older person or something like that, and this machine's talking to you, it's kind of a weird experience for them. I'm sure the technicians will talk to the patients. But anyway, so basically this is what's happening. So the person's lying there, all right? This is the detector ring, and then the x-ray is moving around here. So what you're basically getting, you're getting a picture from here, you're getting a picture from here, you're getting a picture from here, and it's almost like you're putting a spotlight on that certain organ in the person, all right? So where the x-ray, the hole, the beam is right across here, what we're going to do is we're going to take all these spotlights, so to speak, and we're going to focus right on this person, the part. Okay, so what are some of the benefits? Well, again, everyone should have this written down before I even say it. Alrighty, so what are the benefits of getting a CAT scan? Well, before I even say this, I hope everyone's got this written down. You should be saying, dum dum dum, it's non-invasive, all right? You also know, just from the few CAT scans and x-rays that we've looked at, that the CAT scan gives you much better images, right? They're sharp, they're clear, you're going to get a lot more information from them than you do from x-rays, right? As far as your results come, they're fast, it's really easy to get results. It's all computed on the computer. Radiologists can get it really fast and really easy. Right, and for the patient, it's also pretty fast and easy, and it's fairly painless. Again, right, you're in there, you're in and out in minutes. You're laying down on a bed. It's really, the worst thing is changing into one of those hospital gowns, and then it's fairly painless. Now, if you're in there for some weird, break, it's gonna be a little bit more painful, but compared to open surgery, a lot less painful. Now, what are the drawbacks? Dum, dum, dum. All right, so you do get a much greater exposure to radiation. And if you look on one of the handout sheets I gave you, I think I forgot to mention this at the beginning. There's a reference sheet that I posted for you as well. It's got some of the colors of the MRI. I believe on there it's got the different types of nuclear, or the radioisotopes they use for the nuclear scanning. And then on the back page, just because I thought it was kind of interesting, it's got all the different types of x-rays and CT scans that you can get and what the equivalency of background radiation is. So you can see on there the difference between how much radiation you're getting exposed to with a CAT scan versus a x-ray. So again, your doctors don't want to expose you to a whole pile more radiation than you need to be exposed to. All right. Some people have a reaction to the contrast dye. So for sometimes with the contrast dye, what it is it's going to show some organs more clearly, or blood vessels, whatever it is. Okay, your lymph nodes. So they'll give it to you as an IV. And what it does is you can have a reaction to it, an allergic reaction to it. So when you go in there, they make you sign forms saying, I promise I will not sue you, I'm not allergic to the contrast dye, whatever it is. The worst thing with the contrast dye, if you don't have a reaction to it, is it really makes you feel like you need to go pee. You can feel kind of a burning in the back of your throat, and then sort of a burning in your bladder as well. You don't go pee, but it instantly makes you have this feeling that you need to pee, kind of like a burning feeling. Okay, now you can also have some of the contrast dye that can leak under the skin. Now again, that's a problem with a technician not doing a very good job. So that can lead to some real, severe irritation, and hopefully nothing more than just that. But usually it doesn't happen because the technicians are really, really good at doing all that kind of stuff. All right, they've learned how to do a proper IV. All right, and again, the other drawback, it's way more expensive than just getting X-ray. So it's $600 or more to get a CT scan done versus, you know, $100 for a X-ray. Okay, so that's first little introduction to CT scans. Now we're going to talk a little bit about MRIs, and then the second part we'll get into a little bit more information. Okay, so for the magnetic resonance imaging, so we are going to, or MRI for short, we are going to be using magnetic and radio energy for this one. Okay, so if we look on the electromagnetic spectrum, we're using radio waves that are way down here. Okay, so these are the big waves that have a really hard time bashing their way into cells. So here's your little x-rays here. Okay, these ones can get into human cells really, well, not really easily, but they can penetrate cells where these big radio waves don't get anywhere near. Okay. And who invented this one? Well, this guy, his name was Raymond Damadian, and only in 1977. And the story goes that he was, well, it wasn't just him. Again, it's him and all his workers and his PhD students and all that who are developing this magnetic resonance. And he was quite a big guy. So when they first tested it, he went in to be the first test, and they didn't get very good results from it. And one of his young female students had said politely, "Perhaps it's your size. Would you mind if I gave it a try?" And then she went in, and everything was really, really good. So they just knew that it was his size, that he was so big, he was kind of jammed in that machine. Right? Now they do have to make bigger CAT scans and bigger MRIs because of the number of obese people in the world. So, but again, that's going to be massively expensive. Okay, now how this thing works. All right, so how it works. Now, again, we're not physics majors here. I'm going to do a really simple explanation. All right, so simple. So basically, if you remember, your cells contain water molecules. Remember, water is made up of hydrogen and oxygen. So, and these water molecules are spinning in your body in all sorts of different directions. They're up, they're down, they're left, they're right. They're spinning all over the place. Remember, the particles never stop moving. Remember particle theory. So things are moving all over the place, all right? And they're crazy way that they're moving. So what the machine does first is there's high energy magnetic coils, and they're going to take the hydrogen ions that are in the water molecules, and they're going to change the direction. All right, so they're all spinning in their own direction. What they're going to do is kind of make them all point in their own in the same direction. All right, so that's the first part of it. That's totally simplified of what happens, but it makes a little bit of sense. So we're going to turn everybody into one direction. Into one direction. Okay, then what we're going to do is we're going to have a radio pulse. All right, so that radio pulse is then going to spin them all into another direction. All right, so we're going to spin them to all face one way. All right, from wherever they originally started, we're going to have them spin one way. And then what we're going to do is have them spin in a whole different direction, but they're all going to be facing in the same direction. And then what we're going to do is we're going to turn the radio off. All right, the magnetic direction, the magnets are already off. The radio is, we're going to turn this off now. And then all those hydrogen ions are going to spin back into the same direction as where they were. All right, and when they spin back, they're going to be releasing energy as radio waves. Okay, and then the computer is going to interpret how far they spun back into a picture, if that makes any sense whatsoever. So basically, we're spinning them in one direction, we're spinning them in the other direction, and then we're going to turn off the radio waves when we spin them in the other direction. They're going to go back to where they originally were, and the amount of energy that they release when they go back to where they originally were is going to be calculated by the computer and then converted into an image. Right, so when the radio frequency switches off, the atoms release the energy when they turn back to their normal position. Okay, and then the signal is sent to the computer, and the image is again displayed on the screen. So we're going on to screens here again. All right, so it's kind of like winding a little wind-up toy and then winding in the opposite direction, which doesn't make any sense, but whatever. And then you just let the wind-up toy go not the greatest example, but it's best I could do. All right, so why are you going to get a MRI? Well, a lot of times when people have soft tissue injuries, they're really, really difficult to see, right? They're difficult to see in an X-ray. They're difficult to see in a ultrasound. So the MRI is going to give you a nice, clear image compared to something like an ultrasound. Alrighty, so what are we going to use an MRI for? Well, we're going to use an MRI for soft tissue injuries, so things like your ligaments, your tendons, or your muscles. You know, if you have a ligament pull or a ligament tear or a tendon tear, we're going to use that. So that's why you hear a lot of sports people end up getting MRIs, because they have a lot of ligament, tendon, and muscle injuries because of doing sports. Okay, we can also look at heart and blood vessels. All right, even though we have other manners to look at heart and blood vessels. And if we want to look at the brain or the spinal cord, so we want to be able to look at the soft, fleshy brain or the soft, fleshy spinal cord, we're going to use an MRI. Again, if we want to look at the bones, so the vertebrae, we'll use a CAT scan. But if we want to use look at the spinal cord, we would use an MRI. So all the fleshy stuff, soft stuff is what we're going to use. Okay. So let's take a little picture of how this thing works. So again, you can watch a video on it if you want. Now this is a little bit more longer, okay? So in this, like if you had to get an MRI in your leg, your feet are going to go first, but a lot of times we're using them for head or for abdomen things, all right? So you're going to be laying on here. You're going to end up going into this machine. Now, unlike the CAT scan, your head was, you were never buried in the machine. With this one here, you're basically in a tube, so there is no opening on the other end, and this is very, very loud, all right? So this is basically how that, literally you're just being wheeled into this great big long tube thing that makes a heck of a lot of noise. And if anyone's had a MRI before, you know what I'm talking about. Now, the time that you're in a scanner depends on what they're looking for. So you could be getting an MRI like within, like it takes 15 minutes to sometimes you're in there for 45 minutes to an hour. So this one takes a little bit longer to go through, where the CAT scan, you're in and out really quick. Okay, so what are the benefits? Well, all right, I didn't put this down here because we say it so many times. It's non-invasive, all right, and the results come come fast as well. It takes a long time while you're in the machine, but once the computer does all the calculating, the results are really quick. So the radiologist can get that again quickly. Again, just like the CT scan, we can get images in any plane, so we can get them axial, frontal, or sagittal, all right, so any direction, and it's fairly pain-free for the patient. Again, it's paying the patootie to be in there for that amount of time, but it's not, it's better than surgery. All right, so the drawbacks, there's more drawbacks for this one as well. For this one, you cannot have any metal implants at all. So if you've got non-magnetic metal implants, if you've got clips or anything that are non-magnetic, although they're making a lot more non-magnetic clips so that you can have a CAT scan, that can be a drawback. There was a big thing a few years ago that if you had a tattoo, it would cause all sorts of problems in an MRI. Some people experience a little bit of burning, and I think it's because a lot of those dyes that they use in the tattoos do contain metals. They contain iron and cadmium and all sorts of metals. So there was a big brouhaha about people couldn't have an MRI if they had tattoos, or you couldn't get an MRI if you had like so many tattoos. There was a study that I just read it yesterday, and it was saying that really most people don't have any problem with it, and some people feel a little bit of heat, but it's nothing compared to what they're worried about. Okay, now there are stories of people who because they're heavy duty magnets, and this is so weird to me, but I was reading a couple newspaper articles, like online articles, and they were talking about oxygen tanks being in the MRI room. So I don't know if someone's coming in with oxygen, or it said like a nurse was carrying an oxygen tank, and I'm like, what the heck? Where latest one was in the States somewhere, I think a 5-year-old was killed because the oxygen tank got pulled to the MRI machine and bonked him on the head. And then there's been stories about people staying in the MRI room, and like a nurse forgot that she had scissors in her pocket and it ripped out of her pocket. And then there's a story about a criminal that was in custody, had his guard there with him, and he was in the machine, and the guards gun got pulled out of his holster, and then, sorry about that, and then shot in the room or something like that. So you just really have to be careful about metal implants. Now, they do ask if you have any chance of having any metal in your eye whatsoever, if you have any type of eye injury where you may have got a little bit of metal in your eye, because it can rip the metal right back out and cause blindness. So you have to be, pretty honest when you're telling them about having any metal in you. Okay. Now the next thing is can be quite claustrophobic. So I remember I had an MRI once, and I teach this course. So I go, claustrophobic feelings of some patients. So then my doctor's like, oh, you have an MRI. And then she said, are you claustrophobic? I'm like, no. And then my husband said, oh, are you claustrophobic? And I said, no. And then when they called to make the appointment, they're like, are you claustrophobic? And I said, no. And then I got there and they said, are you claustrophobic? And I said, no. And then I got in the machine and I was like so worried about being claustrophobic. I honestly became claustrophobic in like a minute. I was just in there. I had to make myself deep breathe and all that kind of stuff. But if you are claustrophobic, what they'll do is they'll give you an Ativan or something to help you calm down before you go in there. And they do have like a safety thing so that you just come shooting it right out there if you do have some problems. And what they do too is if you're in there for quite some time, they put headphones on you so you don't have to listen to all the banging, and sometimes they'll play music for you, like you can choose your music. I didn't. They just put easy rock or some horrible station on when I was in there. Okay, so you can be distracted while you're in there. It's not like you just have to sit there and listen to the banging and be claustrophobic. Okay, it is loud. Like I said, it's very, very loud. So they'll give you earphones for it. And in Ontario, again, it's expensive. So it's $750 to $950. And keep thinking about this too. That's the price just to get the film made. I know you're paying for the technician and all that kind of stuff, but these machines are millions of dollars. Like you can go online and look at the price of these things, and then the maintenance per year are millions of dollars as well. And then here's a way, if you want to make some money, become a technician that actually fix these machines, because you have to be smart to fix these machines. All right, so you could basically write your own ticket, because there's not that many people who know how to fix MRI machines. All right, so I believe, that's the last slide. Okay, so that's it for us for today. We'll get into talking about the planes and looking at the different planes, how we cut through to look at the parts of the body. Okay, so again, no quiz for this. There is a short article about the CAT scanner in North Bay. That'll go into the Dropbox. Work on your ISU. And I think that's it. So have a good weekend, everybody, if you're watching this before the weekend. Alrighty.